Good morning, and thank you for being here with me today. There's something I've wanted to talk about openly for a long time because in more than 20 years of clinical practice, I've noticed that this particular subject gets whispered about, joked about, or avoided entirely when it deserves an honest, grown-up conversation. My name is Dr. Rosy, and I've spent my career helping adults understand their bodies without shame and without fear. And if you're over 60 and still enjoying an active, intimate life, I want you to hear this clearly. That is completely normal, it is healthy, and it is something worth protecting. But there are a handful of warning signs that a lot of older adults brush aside, assuming they're just part of getting older, when in reality, they can be the body's early way of raising a hand and saying, "Pay attention to me." Some of these signs are subtle. One of them, the one I'll save for the very end, is something so many people dismiss as harmless that they never mention it to their doctor, and yet it can be one of the most important clues your body ever gives you. So stay with me all the way through, because that last one genuinely surprises even seasoned physicians. Now, before we begin, I want to set something straight, because I think it matters. There's a quiet myth in our culture that intimacy has an expiration date, that once you cross a certain birthday, that part of life simply closes up shop. It doesn't. Large surveys of older adults have consistently shown that a substantial portion of men and women in their 60s, 70s, and even 80s remain sexually active and describe intimacy as an important part of their well-being. Your body changes with age, of course it does, but changing is not the same as ending. The trouble is that when normal changes and real warning signs start to blur together, people stop knowing which is which. And that confusion is exactly where problems hide. So today, I want to walk you through the signs that deserve your attention, moving gently from the ones people notice most often toward the ones that quietly matter the most. And I promise to explain not just what to watch for, but why it happens inside your body, because once you understand the why, everything else makes far more sense. Let's start with something familiar. Many men over 60 begin to notice that erections aren't quite as firm or as reliable as they once were. It's tempting to file this under just aging and leave it there. And to a degree, some change is expected. But here's what I want you to sit with for a moment. An erection is not really a sexual event first. It's a cardiovascular event. It depends on healthy blood vessels relaxing and filling with blood on demand. The arteries that supply the penis are quite narrow, much narrower than the arteries feeding your heart. So when the lining of your blood vessels begins to stiffen or accumulate plaque, those small vessels tend to show trouble first, sometimes years before you'd ever feel a symptom in your chest. Do you see why this matters? Erectile difficulty in an older man is often not just about intimacy at all. It can be an early messenger of the health of your entire circulatory system. Researchers have described this as a canary in the coal mine, because new or worsening erectile dysfunction has been linked in multiple studies to an increased risk of future cardiovascular events. That doesn't mean every man with this concern has heart disease, not at all. Diabetes, medications, hormone shifts, stress, and dozens of other factors can play a role, and many of these are very manageable. But it does mean this is a symptom worth mentioning to your physician rather than quietly enduring. Think of it less as a bedroom problem and more as your body handing you a report card on your arteries. And if that's the message hiding inside something so many men feel embarrassed to discuss, imagine what other signals we tend to ignore. That brings me to changes in urination, which is one of the most common concerns I hear from men in this age group. Getting up once or twice at night, a weaker stream, a sense that the bladder didn't quite empty, a bit of hesitation before things get going. Most men just adjust their lives around it. They stop drinking water after dinner, they map out every restroom on their route, and they assume this is simply what an aging prostate does. And here's the thing, a lot of the time, it is exactly that. The prostate sits wrapped around the urethra like a ring around a garden hose, and in most men it slowly enlarges with age, a benign condition that squeezes that hose and changes the flow. This is extremely common and often not dangerous at all. But this is where I want you to slow down with me, because similar symptoms can come from very different sources. The same changes in urination can be caused by benign enlargement, by infection, by certain medications, by neurological issues, and yes, in some cases, by prostate cancer. Now, prostate cancer is often slow growing, and many men live long lives with it, sometimes without it ever causing harm. But the reason we screen and evaluate is that the early, most treatable stages usually produce no symptoms at all. By the time a prostate cancer is causing dramatic urinary changes on its own, it may be further along than anyone would like. So the lesson here isn't fear, it's simply this: don't diagnose yourself, and don't assume. A conversation with your doctor and a discussion about whether screening makes sense for you turns guesswork into knowledge. And speaking of knowledge, there's a number quietly changing inside your body as you age that almost no one gets checked, and it influences far more than most people realize. I'm talking about testosterone. Here's what surprises many of my patients. Testosterone doesn't fall off a cliff for most men the way it can for women during menopause. Instead, it tends to decline gradually, often around 1% per year after your 30s or 40s, so slowly that you barely notice it happening. And because the decline is so gentle, men tend to attribute the effects to something else entirely. Low energy, they blame on age. A flatter mood, they blame on retirement or boredom. Loss of muscle, difficulty sleeping, a fading interest in intimacy, they chalk all of it up to just getting older. But sometimes these threads connect back to a single source that a simple blood test can reveal. Now, I want to be very careful and very honest here, because this is a topic surrounded by a lot of hype and a lot of overselling. Low testosterone is real, and for the right patient, addressing it can genuinely improve quality of life. But testosterone is not a fountain of youth, and it is not right for everyone. It carries real considerations, it needs proper monitoring, and treating a number on a lab report without symptoms is rarely the answer. What I want you to take away isn't that you should demand a prescription. It's that if you've been feeling persistently drained, low, and disconnected from parts of life you used to enjoy, that deserves investigation rather than resignation. You may be surprised how often a treatable cause is hiding behind what everyone told you was simply the passage of time. And that theme of hidden causes leads directly into the next sign, one that people are perhaps the most reluctant of all to talk about: pain or discomfort during intimacy. This is something both men and women experience as they age, and it's wrapped in so much silence that people will suffer with it for years rather than say a single word. For women after menopause, the drop in estrogen leads to thinning and drying of vaginal tissues, which can make intimacy uncomfortable. Many women assume this is permanent and untreatable, and simply withdraw from that part of life. But this is a well-understood, very treatable change, and no woman should feel she has to endure it in silence. For men, discomfort can signal infection, inflammation of the prostate, skin conditions, or circulation issues, among other possibilities. Here's the part I really want to land. Pain is never something to power through or ignore in the hope it goes away. Pain is information. It's your body telling you that something has changed and wants attention. And when we address the underlying cause, whether that's tissue changes, an infection, or something else, we're not just restoring comfort in one area of life. We're often catching a condition earlier than we otherwise would have. Yet even pain, as loud a signal as it seems, isn't always the most telling clue. Sometimes the most important sign is something you can actually see, and it's the very thing people are quickest to explain away. Let's talk about blood. Blood in the urine, or blood in the semen. I know just reading those words can spike a little fear, and I understand that. But I want you to hear this from me calmly, because the way people typically respond to this sign is the real danger. When someone notices a trace of blood once, and then it doesn't come back, they breathe a sigh of relief and decide it must have been nothing. And here's what surprises many patients. With these particular signs, the fact that it stopped tells you very little about whether it mattered. Let me explain why. Blood in the urine, what we call hematuria, can come from something very minor, like a small infection or a stone. It can also be an early sign of something in the bladder or kidneys that we very much want to catch early. And crucially, these serious causes often bleed intermittently. They bleed once, then stay quiet for weeks, then bleed again. So the disappearance of the blood is not reassurance, it's simply the pause between chapters. Blood in the semen, while frequently harmless and often related to minor causes, follows a similar rule in older men. It deserves an evaluation rather than a shrug. This is one of the clearest examples I can give you of why "it went away on its own" is one of the most costly phrases in medicine. If you see blood where blood doesn't belong, even once, even if it never returns, that is a reason to be seen. Not a reason to panic, but a reason to pick up the phone. And that principle, that some of the body's quietest signals carry the loudest importance, brings me to the sign I promised you at the very beginning. Here's the one almost nobody talks about, and the one I most wish more people understood. It's a change in the frequency or nature of your intimate life itself, when that change happens suddenly and without an obvious reason. Let me explain what I mean, because this is subtle. We expect gradual shifts with age. That's normal. But when a person who has been consistently active experiences a fairly abrupt loss of interest, or a sudden inability where there wasn't one before, or a marked change in sensation, that shift is worth paying attention to, because it can be the visible tip of something happening beneath the surface. Why does this matter so much? Because intimate function sits at the intersection of nearly every system in your body. It depends on your hormones, your blood vessels, your nerves, your emotional state, and your medications, all working together. So a sudden change in that function can be the first noticeable sign of things like a shift in blood sugar control that's damaging small nerves, a new cardiovascular issue, a thyroid imbalance, the side effect of a recently added medication, or even depression, which quietly touches this part of life more than almost any other. Do you see the pattern? The very same reason people feel embarrassed to bring this up, the feeling that it's private or trivial or just a natural decline, is exactly the reason it so often goes unexamined. And in going unexamined, a genuinely useful early warning gets thrown away. I'll add one more layer here that I think about often. Emotional and relational well-being is not separate from physical health at this stage of life. Intimacy in older age is tied to lower stress, better mood, stronger relationships, and a greater sense of connection and purpose. So when this area of life changes suddenly, it isn't only a medical clue. It can affect a person's whole sense of self and their closest relationships. That's why I never treat these conversations as awkward or minor. They're among the most human conversations I have. And they remind me why silence is the real enemy here, not aging. So let me pull all of this together, because I don't want you to walk away with a list of things to be frightened of. That's the opposite of my intention. Fear makes people avoid their doctors. Understanding brings them in. What I want you to carry with you is a shift in how you interpret your own body. That softening in firmness may be your arteries speaking. Those changes in urination deserve a real evaluation rather than a lifestyle workaround, because several very different conditions can look identical from the outside. That persistent fatigue and fading interest might trace back to a hormone level worth checking, though never something to chase blindly. Pain during intimacy is information, not a life sentence, and it's very often treatable. Blood where it doesn't belong warrants a call even if it vanishes. And a sudden, unexplained change in your intimate life may be the earliest, most honest signal your body can send you about your overall health. Notice what every one of these has in common. Not one of them is solved by embarrassment, by waiting, or by hoping it passes. Every single one is served by the same simple act, an honest conversation with a physician who takes you seriously. You don't have to have the right words. You don't have to feel comfortable. You just have to walk in the door and say, "Something's changed, and I want to understand it." That sentence has protected more health and saved more lives than any single medication I could name. And I want to say something directly to those of you who've been quietly carrying one of these concerns for months, maybe years, telling yourself it's not worth bothering anyone about. It is worth it. You are worth it. Your later years are not meant to be spent slowly surrendering the parts of life that bring you joy and connection. Your body is not betraying you by aging. It's communicating with you, the way it always has, and it's asking you to listen a little more closely now. The people I've seen do the best in this stage of life are not the ones with perfect health. They're the ones who stayed curious about their bodies, who asked questions, and who refused to let embarrassment make their decisions for them. I always want to be honest with you about the limits of what any of us can promise. I can't guarantee outcomes, and anyone who promises you a cure for anything should make you cautious rather than hopeful. What I can tell you is that catching things early, understanding your own body, and building a real partnership with a doctor you trust consistently gives you the best odds and the most options. And options, at any age, are everything. Many of these symptoms can be caused by conditions that are far less serious than your worried mind might imagine, which is one more reason to get answers instead of living with the uncertainty of guessing. If this conversation helped you feel a little less alone, or a little more willing to make that phone call you've been putting off, then it did exactly what I hoped it would. Please take a moment to like this video, because it genuinely helps this kind of honest health information reach more people who need to hear it. If you'd like to keep learning about your body with clarity instead of fear, I'd be honored to have you subscribe, where I share evidence-based conversations like this one regularly. And if there's someone in your life, a partner, a friend, a brother, who you know has been quietly ignoring one of these signs, share this with them. You might be handing them exactly the nudge they needed at exactly the right time. Take good care of yourself, be gentle with yourself as you age, and never let embarrassment stand between you and your health. I'm Dr. Rosy Adams, and I'll see you in the next one.